Hello and welcome to this 60-minute presentation for the Alternative Medicine College of Canada. Today we'll be talking about clinical case examples from the naturopathic practice. This is our agenda for today. The presentation today is a teaching complement to the module F924 with particular emphasis on the case study in nutritional therapy. We'll start today's presentation by talking about the questions to ask patients during the intake, both during the first intake and during the follow-up visit. And then we'll move on to a few clinical cases, examples from the practice, to understand what to gather from the first visit, how to analyze the information from the first visit, implement a treatment strategy, and how to follow through in the next follow-up visit. We need to discuss a little bit more about questions to ask the patients in the intake because this is absolutely crucial to the success of your naturopathic intervention. The way you gather information determines the pieces of the puzzle that you will be gathering, and a clinical picture will come together from these puzzle pieces. And it is this clinical picture which represents the analysis of your case. And that is what will drive the various intervention strategies and recommendations that you will make to your client. Therefore, if during the intake the wrong questions are asked, you will not be gathering the right information and it will be very difficult to put together an effective treatment strategy. There are a lot of things that are going on with one person, and during the intake we want to be as open-ended as possible while still directing the patient towards the things that matters to us in terms of their symptoms. Basically, as we ask the questions, we have gradually a picture that comes together that will tell us a little bit more about where the root of the problem lies. As the person answers the questions, we realize that maybe it is mostly a stress issue, a cellular toxicity issue, maybe it's a nutritional issue, maybe we need to tackle hormonal imbalances. So there are really very different routes that can come through the intake, and it is a route that we need to tackle. And for this reason, we need to be asking the right questions. The other thing that happens during the intake is that we start having a better idea of the profile of our patient. Depending on what kind of personality the person has, it becomes clear that certain interventions just won't work for them, and others will. So for instance, here on the left, we may have an older gentleman who looks quite exact and meticulous. We can see that from the way he's dressed. Appearances are important for him. He's wearing a tie. Everything looks very neat. We already know that this person probably has a great deal of self-discipline, and so he could go on a strenuous dietary intervention, and that would be fine. On the right-hand side, we have this lady here who looks very disorganized, overwhelmed, emotional. For this person, it will be more difficult to put her on a stringent dietary plan, and we may need to work with supplements more, and we may need to do a little bit more active listening, and perhaps use calming herbs to try and get her to be a little bit more grounded for the rest of her treatment intervention to go smoothly. Or maybe it's the person in the middle, a corporate person who is overworked, stressed, not sleeping well at night, has fatigue issues. In that case, we already know that we may need to run some lab tests regarding her iron status, vitamin B status, and that she will probably need an intervention that has a stress management component. So the personality of your client is also quite important, and this will come through in 1,000 little ways during the intake, in the way they answer the questions, in their appearances, in their speech and mannerisms. So all of these things we need to take in during the intake. So it's not just about the questions that you ask, but also the overall impression of the client. But of course, asking the right questions is also crucial. In the way we ask the questions, we start gathering the puzzle pieces that we actually need for our case analysis, and therefore for our treatment strategy to come together. So here are 5 of the main points that will structure the first intake. Of course, we will start with the chief complaint, and we need to first package that with a little introduction. Remember that our clients are used to going to medical doctors where they spend 5 to 15 minutes with the practitioner, and therefore they are trained to answer in a very succinct manner about the very physical and materialistic aspects of their health. They're not really used to medical practitioner asking them about anything more than that, even about their diet, their sleep, their stress levels. And so in the introduction, when they first come in, it's important to inform them that this visit will take about an hour and that they will be asked a lot of questions about the main reason for their visits today, but also about lots of other factors affecting their health. And I literally say that to them, and I usually end with a bit of humor, and I say to them, so are you ready? There's a lot of questions for you in the next hour. And that's a good way of introducing the first naturopathic visit and making your client feel safe, so that they want to open up and share everything that's going on with them that may be relevant to the way they're feeling. So of course, we always want the client to start with their chief complaint. That is actually what brings them to the clinic. So we need to ask them everything there is to know about the chief complaint, and we'll delve a little bit more into that during our case examples later on. Once they're done talking about the chief complaint, we want to ask about secondary symptoms, and they may come through already when the client is describing their chief complaint. So for example, if they tell you that they have headaches during their period, and then they say that their periods are really heavy and terrible and painful, that is already our secondary symptom. So if that happens, I will usually make a note on the side of the page in their file to remember to go back to that secondary symptom, because I first want them to exhaust everything there is to say about the chief complaint, and once they're done, I will direct them towards that secondary symptom that they mentioned. Sometimes in the first 5 minutes, they will already describe 15 things that are going on with them because they already made a little mental list as to why they've come and seen you. So they may say, I've come for my headaches and for my episodic fatigue and for my regular periods. So in that case, I will ask them, which one is the most primordial and bothersome to you that you'd like to address first? And then I will delve into that chief complaint, and I've made a little note on the file to go back to the other 5 things that they've mentioned to make sure that we're thorough. Once they've told me about the chief complaint and the secondary symptoms, I ask them if they have any recent medical test results. Then we'll ask about the context, and we'll wrap up with a few last details. So that is the way the intake looks. The first intake and follow-up intakes basically look the same. It's just that in the first intake, you've gathered everything you need to know. So the follow-up is literally about just checking in and seeing how these symptoms that they've mentioned in the first intake have evolved. And usually as follow-up visits develop, more and more things will come up. So for instance, if they initially came for their headaches and after 3 months you've resolved their headaches, you won't see them for a while, and then they may come in with a relapse of their headaches, or maybe now something totally new and fresh has come up for you to work with. So here our 4th bullet is contextualizing symptoms. So what that essentially means is, right, they've told you everything about their chief complaint and things that bother them. Now you want to find out more about their life in general. What goes on around these symptoms, and are there lifestyle factors that they generally do that don't seem to be a problem that are feeding into these symptoms? So for instance, we'll ask them about their energy levels, sleep, diet, and stress. And for each of these bullet points, we have several other sub-questions. So you might start by asking how are your energy levels in general, and usually I ask the patient to rate that out of 10. And then there are 3 vital questions to ask. So these pictures represent those questions. So from left to right, the first picture is, how do you feel when you wake up in the morning? If they tell you that they wake up feeling very fatigued, it is already a little sign possibly of adrenal fatigue, or a sign that their sleep is poor, which would then lead you into the next question. The middle picture here is, do they feel the need to take a nap, or do they have a strong feeling of sleepiness in the afternoon, which again might point to adrenal fatigue or stress, of course. So that might feed you into your next context question, which would be about stress. And the question on the right-hand side is more about their stimulant intake: caffeine, black tea, green tea, chocolate. And sometimes alcohol goes in with that question because some people have both a stimulant addiction to caffeine and a depressant addiction to alcohol. So they need the stimulants to perk up during the day, and they need the alcohol to unwind at the end of the day. So some people will tell you that their energy levels are really pretty good, like they'll say it's 8 out of 10, and that they don't feel sleepy in the afternoon. But then they'll tell you that they have a double espresso in the morning and another 2 coffees in the afternoon. And then you need to ask them, well, how would you do without the coffee? And you realize that actually without the coffee, their energy levels is more like a 3 out of 10. So these questions are all really important. Another one you may wish to ask is, are they able to exercise? How are their energy levels with physical activity? And if physical activity is a problem, you may also think of iron deficiency as a cause of their fatigue. So that is our first context questions, all about energy levels. That naturally feeds into how their sleep is. So here again, there are 3 really important questions around sleep. One of them is, of course, how is their sleep? Do they fall asleep easily, and is it really nice and uninterrupted throughout the night? Or do they wake up at night for whatever reason and are unable to fall asleep again? Or maybe falling asleep is problematic already early on in the night. So again, all these little questions tell you a little bit more about the root cause. The middle question is, sometimes people sleep through the night, but they feel like their sleep is very light, restless, full of vivid dreams, and that's also an important question to ask. So if the person tells me that they sleep very lightly, that they have muscle cramps at night, that they wake up with the smallest sound, usually I think of a magnesium deficiency or another mineral deficiency like calcium magnesium. And it usually tells me that there's a significant stress picture here and maybe an adrenal picture. For example, if it's a woman who's in her late 40s or 50s and she tells me that she wakes up at night feeling hot, feeling cold, needing to go urinate, that she starts having anxious thoughts at night, then I'm thinking more of a perimenopausal picture, and therefore she may need more of those phytoestrogenic herbs and magnesium to help her through this period. And on the right hand side here, of course, you always want to ask about sleeping aids. So if the person tells you that they have difficulty sleeping, you need to ask them, well, have you ever taken anything prescription or herbal to help you with sleep? Again, some people you'll find out really need their melatonin. Others have antihistamines or anxiolytic drugs that they take at bedtime. So again, that tells you a little bit more about how entrenched the picture is and how much of that crutch they need for them to have a good night's sleep. The third important bullet point about context is their diet. Of course, that is a really, really crucial thing to ask about in the naturopathic practice. And I always start, because if you don't direct that question, people will tell you very vague things about their diet. So for example, some of my Chinese patients will say, oh, I have a typical Asian diet. So that doesn't really help me a lot. Some people who have a terrible standard American diet will say things like, oh, I think I eat pretty healthy, but are actually not very descriptive in the content of their diets. So when I ask them about their diet, I usually start with a pretty directive question, which is pictured on the left-hand side here, where I'll say, what do you eat on a typical day, breakfast, lunch, dinner, and snacks? And sometimes I'll be like, oh, I can't even remember. And then I'll prompt them with, what did you eat this morning? What did you eat yesterday morning? And usually it's not really a problem from there. So I ask them about breakfast, and then do they have a morning snack? What do they have at lunch? What they have as an afternoon snack? Do they need an afternoon snack? Do they have cravings? What's dinner like? Do they have evening snacks? And usually from that you can also gather whether they eat home-cooked foods, whether they're eating out a lot. It's also important for them to distinguish for you if their weekend diet is significantly different from their weekday diet, or sometimes they'll have told you about their chief complaints, which sound very dietary in origin, like for instance, they're overweight. And you find out from their energy levels that they're caffeine addicted and they don't look like that health conscious in the first place. And then their dietary description is really, really good. So then my next question would be, and have you always eaten like this? Or is that a recent dietary change that you've made? And so you'll find out that some people have had a terrible diet, but because they've been feeling really off and maybe they read up about gluten or their friend told them about something in their diet, you'll find out that they've cut out gluten for the last 4 days. So it's also important to listen to your guts so that you can ask the right questions. The middle picture is the active question of whether they avoid any particular foods. So some people may have already self-prescribed themselves a gluten-free diet, a dairy-free diet. Maybe they identified intolerance to eggs or something else. Some are vegetarian, some are vegan. There's all sorts of things out there. Some people do paleo. So you need to find out about any special diets they may be on. And finally, again, our stimulant and depressant question. What is their relationship to coffee, sugar, and alcohol? It's always a good idea to gauge their cravings. That tells you about whether that feeds into their problem or not. And our last context question is, how about your stress levels, which is super, super important because obviously in our modern day world, stress is a huge contributing factor to a number of functional health conditions in particular. So again, I usually on the left-hand side here ask them to rate their stress levels out of 10 or out of 100 to have some idea of the stress pace of their lives and whether the stress is sort of always there, or do they currently have some project that will end soon. So is it a work stress kind of thing, or is it a stay-at-home parent who's really stressed about their kids and sleep deprived? I also in the middle here want to know more about whether they have long hours. Do they go to bed really late because they're stressed out? Do they stay up with evening work calls at night? Do they stay up because that's their me time and so they have difficulty unwinding in the evening? And finally, on the right-hand side here, that's our Donald Duck. Do they have any relaxing activities that they've built into their routine? Activities that are non-competitive, that they look forward to, that allow them to regenerate beyond just like watching TV. So that was our 4 questions about context, energy, sleep, stress, and diet. And once you've gathered all of this, at this point of the intake, you already have a lot about the chief complaint, about secondary symptoms, you know the context. So by now you really have a pretty good idea of where this is going. And now you're only left with the last few important details, which is what meds and supplements are they on, more about their medical history, and a review of systems. So this is really to wrap up. Sometimes too, by now you already know what medications they're on because they may have gone into this when they described their chief complaint, like, you know, I have diabetes, I'm taking metformin kind of thing. But it's always good to formally ask the questions because there are some medications that people don't think about as medication and you need to more actively ask about them. So I generally ask them what kind of prescription items are you on. They'll describe something. I will always ask them, are you on the birth control pill? Because a lot of women don't think of the birth control pill as medication. They think it's just a kind of health promotion thing. And I also ask them about either sleeping pills or antidepressants or anxiolytics. Because a lot of people with depression or anxiety feel ashamed and they don't want to share that they're taking an antidepressant, even though it's really important for you to know that, because if you're thinking of recommending herbs, for instance, or any supplement really, you don't want that to have an interaction with whatever drug they're on. So you need to know. And also, if they're taking a strongly suppressive drug like a biologic or immune modulator, an oral steroid, you need to know this because it may actually be very difficult to treat their chief complaint if they've been on strong medications for a long time. It tells you that the problem is entrenched. It'll be hard to get to the root. You'll first need to wean them off whatever they're on. So the medication and how long they've been on it is a really important thing to know about. Then obviously you want to know about their medical history. Have they had surgeries? Have they had accidents? Have they had chronic illness diagnoses in the past? So, you know, for example, I have a client who comes in with constipation, which in the naturopathic practice should be really easy to treat. But in the medical history, you find out she has Ehlers-Danlos syndrome, which is actually a congenital collagen disorder, which really affects gut motility. So in this person, you know that there is something structural in her gut that makes it very difficult for her to be regular with her bowel movements. So you already know it will be a lot harder to help this person, and you may need to manage their expectations. And finally, a review of systems. So what the review of systems is basically is going over every single body part from top to bottom so you don't forget anything, just to find out if there's any extra little clues that they maybe haven't told you about. So usually I do that at the very end, and it can be pretty quick. So I'll say, right, thank you for sharing all this information. Now we'll just move on to the review of systems, which is talking about different body parts from the top down, just to make sure we don't forget anything. And they're usually fine with that. So we start with hair because it's at the top. Anything that has to do with hair, hair loss, itchy scalp, any issues with their head like headaches, migraines, concentration and memory. Then we move on to anything around their face, any eye issues, allergies, runny nose, dental issues, colds and flus. Then we move on to throat, any thyroid problems, tonsillitis, sore throats. Have you had lots of antibiotics in the last year or 2 years because of colds and flus? Then we move on to chest, so that lungs and heart, any asthma, bronchitis, palpitations. Palpitations is a really good one to ask about because sometimes it's quite minor, people don't think about it, but if a person has palpitations, I think either anxiety, perimenopause, magnesium deficiency, or wait a minute, this is really bad, they should really be seeing a cardiologist. So don't forget to ask about palpitations. Then we move on to digestion, which is really, really crucial. Digestion usually ties in with diet. Digestion tells you a lot about this person, how they're doing, how they'll be doing in the future. So I also work from the top down with digestion. So top is esophagus, any acid reflux, heartburn, burning stomach. Then we move down to the small and large intestine. Do they feel bloated? Do they pass gas? How are their bowel movements? It's really important to know about bowel movements. You want them to be daily, once or twice a day, formed. Any departure from that is a problem that needs to be fixed, essentially. Then we move to kidney and urinary system, any kidney stones, urinary tract infections, gynecological or genital problems, so periods for women, vaginal thrush, any kind of growth like polyps, fibroids. In men, you could also ask about prostate. Then we move on to skin. Most common ones would be hives, acne, eczema, and finally any muscle aches and pains, back pain, knee pain, any muscle cramps. That's pretty thorough. Sometimes I ask as a last question, do they ever feel a little bit dizzy when getting up quickly? For me, that's a little clue about adrenal depletion or iron status in general. So it's a good little question to ask. Obviously, you need to put it into context. If the person has like a cholesterol, diabetes, cardiac picture, and they're taking blood pressure and lowering medication, that may also be why. So again, the context is super, super important. So that basically wraps up your first intake. So it'll be about an hour typically. So you see that it's a mixture of active listening. So active listening is you're present for your patient, you're non-judgmental, you ask open-ended questions. You really want to be a sort of blank slate to receive the information that's coming from your client. So you're doing that, but at the same time, you, in the background, already start analyzing the case to be able to explain the treatment intervention to the client at the end of the first visit. And at the same time, you are at times asking directive questions. Why? It's because if you're doing active listening, but you end up with a very loquacious patient, they may start talking about all sorts of things that are just not relevant to you. They may diverge, go into tangents. You need to guide them so that you do gather your puzzle pieces. And even if you're doing a little bit more counseling and you're doing active listening, if you start feeling bored during the intake, you know that this is not relevant material to you and you need to cut them and redirect them. So it's quite a few different skills that are going on in the intake. So let's move on to a few case examples so that you can see what it really looks like in practice. So we'll go over people that I have actually seen in the practice that have just basically changed their names. So you see what it looks like. And we will have a bit of an emphasis during this presentation on the nutritional therapy case presentation homework that you need to do as part of this module F924. So we will analyze the diet a little bit more and talk more about that so you can see what it looks like. But it is holistic, so it's not just about diet, it's about everything else that goes around it. So this is our first clinical case. We'll call her Bernadette. She's 42 years old. She tells you that she suffers from small near fainting episodes, and that has been going on for 2 years. So you ask her more about that, and she says she wakes up, she feels really good, but around 3, she feels really dizzy. She feels a sort of heat all of a sudden, nauseous a little bit, and sometimes it's that bad enough that she needs to lie down and air herself with a fan or air conditioning, otherwise she may faint. She's never really fainted before, but it feels like that. When you ask about context and so on and secondary symptoms, she tells you she feels bloated, she passes a lot of gas. She generally wakes up and her tummy feels fine, but as the day progresses, it becomes worse and worse and worse. So that was the chief complaint and secondary concerns. Now context. Energy, good in the morning, but obviously, as she has these near fainting episodes, her energy dips significantly. And as the bloating and flatulence becomes worse, she starts also feeling extremely sluggish, so more later on in the day. But we know her sleep is really good. She falls asleep quickly, it's not interrupted, she wakes up, she's fine, so it's not a sleep problem. Her diet, she doesn't drink any alcohol, and she's already been gluten-free for about 6 weeks because she thought it would help the bloated feelings, which it has somewhat. Her breakfast is orange juice and a bowl of Chinese rice noodles because she's Chinese. At lunch, she has a big bowl of white rice at the food court with green veggies and sauteed chicken. In the afternoon, she starts feeling sluggish, tired. She may have that fainting feeling. So as a pick-me-up, she may have a Starbucks muffin with decaf coffee. Or sometimes she feels fine and she has that and later on doesn't feel so fine. And dinner is at home and she tries to be really healthy for the last 2 months or so. So she has a baked sweet potato, a grilled fish, and green veggies. Her stress is mostly caused by her state of health. The rest of her life is not that stressful, but because every day she feels fainty, it stresses her out, obviously. She's not taking any prescription items, only omeprazole, because she gets occasional heartburn. She used to have a lot more heartburn, so she used to take omeprazole all the time. But now, since she's been gluten-free, it's actually very occasional. In her medical history, she has very heavy periods and so has had severe anemia in the past where she has needed to have IV iron and should really be taking iron supplements, but she doesn't like them. It makes her feel nauseous and constipated, so she's not on them. This is the relevant items from the review of systems. She's been having hair fall for a while. In the evening, she has had palpitations, quite minor, but there for the last few months. She used to exercise more, but now she just generally feels tired, and physical exercise makes her feel more tired and unwell, so she no longer exercises. She still has the occasional acid reflux, and her periods are regular but extremely heavy. She's had that checked out in the past. Turns out she has 2 small fibroids, which the gynecologist has not wanted to remove at this point, although they are probably a contributor to the abundance of her periods. So that's it. You know all of that about Bernadette. So now you need to start analyzing things. In the context of your nutritional therapy module, let's start by analyzing her diet. So remember, this is what she has told you about her diet. So without making any calculations or looking into any databases, right away you can tell that her diet is way too rich in starches and in sugar. Remember, this is a sedentary 40-year-old female. She's not a child who's growing. She's not a very active teenager. She's not an athlete. She's just your regular kind of office person. And so she really does not need this much starch and sugar. And this is probably significantly contributing to a bacterial imbalance in the gut. So all this starch is just feeding a whole bunch of bacteria, which are making her feel bloated and creating the heartburn. And the heartburn may be also contributing to that feeling of malaise in the afternoon. So she's bloated, it's probably pressing a little bit on her vagus nerve, becomes a bit hard to breathe, creates a little bit of that fainting sensation. Or she's going through bouts of hypoglycemia because there's just too much starch and sugar in her diet. So she may have peaks of high blood sugar and troughs of low blood sugar. And if she's sensitive to that, that might create those feelings of fatigue. So without analyzing anything, I can already say she will need to change her diet around a little bit. But in order to have a more specific picture, especially if you're a beginner and you haven't analyzed a lot of diets before and so on, you can rely on certain databases on the web. So this is from the Canadian government. It's a very, very thorough database, and you can basically input everything that she's eating in one day. That's also why you ask her about her portion sizes. So for example, this would be her bowl of rice. So if she's having brown rice, she tells you that she's having a bowl, which represents about 80 grams. And there you have the value for 100 grams of everything in there. Protein, fat, carbohydrates. So you can make a simple calculation to figure out how much carbohydrate is in 80 grams of rice. And then you add that up with how much sugar and carbohydrate is in her glass of orange juice. This is another really good database. You can make a note of it. That also has a lot of things. So between the Canadian government and this, typically you will find most things that people are eating. So you see here that in a glass of pure orange juice, you have about 10 grams of carbohydrate. Sorry, not in a glass, in 100 grams. Okay, so you can just make that addition and then you find out how much carbo, protein, and fat she's having in her day. You will notice that the typical person who doesn't think much about their diet has somewhere between 100 and 160 grams of carbohydrate per day, which for most sedentary people is way too much and will create weight gain, cholesterol, diabetes, hyper and hypoglycemia. SIBO, so small intestinal bacterial overgrowth, can definitely be fed by too much carbohydrate as well. And also sometimes you will notice that people don't have enough protein in their diet. Remember, you want to have about 0.8 grams per kilogram of body weight of protein in your diet. So these will be the two main analyses that you will do for most people's diet, and that contributes actually already to a great deal of symptoms that we see in the naturopathic practice. If you are worried about their vitamin and mineral intake, you can also go to the Canadian website's dietary reference intake. So you see they have here vitamin A, vitamin D, vitamin E, vitamin K. So they have all fat soluble and all water soluble vitamins, and they tell you for every age range. So you see here infants, children, males. If you scroll down, you also see females, pregnancy, elderly. It tells you how much they should be having at a minimum per day. So remember that the dietary reference intakes are extremely conservative and tend to be on the low side for most vitamins. And here you have the same thing for minerals. So if you're worried about a specific vitamin or mineral, you can also do this analysis. So it's a little bit tedious, but it's not very difficult to do. You just addition everything that they've told you they're eating, look up the information on the database, check if it fits the reference values, and that already gives you actually quite a lot of homework to give to your client. So the vitamin, I don't analyze their diets in that way a lot. I'm mostly concerned about macronutrients like carbo, protein. Fiber is a big one. So most people have like 3 grams of fiber a day, but they actually need 20. So that can be a big area where you need to counsel them, especially if they have issues with their bowels. And then I'm concerned about vitamin D. Most people don't have enough vitamin D, which is a big hormonal regulator. Remember, vitamin D is also related to sunlight exposure, so that would be another way for them to get their vitamin D. In vegetarians, I'm worried about vitamin B12, and I'm worried about iron. In people with a standard American diet, I am worried about folate. For everybody, I'm a little bit worried about zinc. All of these you can test on a blood test as well. So you basically analyze Bernadette's diet, and it confirms that she has too many refined white starches, so she probably had peaks and troughs of hyper and hypoglycemia. So depending on what kind of person she is, again, it has to do with their profile. You can either suggest certain general changes in her diet, or if she wants to measure that, you can suggest a glucometer. So the glucometer that diabetics use to prick her fingers and figure out exactly what is her blood glucose during the day. That would be a good way of being very scientific about this, and actually a lot of patients like the measurements, so you can always suggest it. The flatulence probably suggests dysbiosis, so a bacterial imbalance that is due to the excessive starches in her diet. But in a very nice kind of vicious cycle, the omeprazole would definitely contribute to that. We know that a lot of these acid-inhibiting drugs create bacterial overgrowth in the small intestine. Remember, our gastric acid is also meant to essentially sterilize everything that we're putting in our mouth. So when we take an acid-inhibiting drug, we are not killing all of these bacteria, viruses, fungi on our food. And so they make it through and they find a very nice living area right after the highly acidic environment of the stomach in our small and large intestine. So people who have been on things like omeprazole for a long time, they will usually have dysbiosis, and the most common presenting symptom of dysbiosis is basically feeling gassy. The other thing that's going on with her is that she has a history of severe iron deficiency anemia. Remember, she has heavy menstrual periods. And now she tells you that she's fatigued on exercise, she has palpitations and hair loss. So I am thinking of a potential iron deficiency. So this is what's going on in my mind when I analyze her case. So at the end of the first visit, I am ready to make quite a number of recommendations for this person. So first of all, I tell her, you really need to look at your iron levels. You need a blood draw, which she will do between now and next time I see her. Generally, actually, I don't just tell people to test their iron. I would want to see a complete blood count. I want to see their folate and B12 as well, because anemia can be caused by that too. So I would ask her to do all of that with her GP. Or if you're able to send them straight to the lab, that's even better. So now we're changing her diet, but you need to watch out when you change a person's diet. You can't recommend something that is a radical departure from what they're doing. So what I try to do here is look at the way she's eating in a normal day, and I try to suggest things that are essentially the same but less refined starches, right? So in the morning, try to change it to steel-cut oats because that's an unrefined high-fiber starch, almond milk, and a handful of nuts. I'm not recommending dairy milk because this person sounds like her gut's quite irritated, and dairy may be an intolerance that I don't really want to experiment with at this point. I'm adding nuts for the fat and protein to balance out her blood sugar levels. At lunch, I'm telling her, okay, fine, stick to your white rice. Stick to your white rice because she's eating out and choices are a bit limited and she likes her Chinese food court. But now it needs to be like 3 tablespoons of rice. And you now need to have more of the chicken, more of the greens. Okay? And it's the kind of person you won't be able to remove the afternoon snack just like that because she's very dependent on it. So now we switch her to a higher protein snack like a little Greek yogurt or a boiled egg if she's up for it. Or some people like the option of like a smoothie with protein powder, a bit of stevia for taste, and almond milk. And you know what? If they tell me they want to buy the chocolate almond milk, I let them. I feel like any baby steps is useful. And when they see that they can make small changes, it's usually easier to drive them toward bigger changes. And her dinner stays the same, except we've reduced the sweet potato and told her to up the portion of fish, green veggies, and maybe add a little bit of olive oil on top of all of that. To again have balance her blood sugar levels and make sure by reducing these starches she's not starving, because that might happen, right? If you cut out starch and sugar too much, they become hungry, they have cravings, and they just feel worse. And because she's already been so good with gluten-free for 8 weeks, I would tell her to keep going. She's felt better since she's off gluten, so it's likely that there's a food intolerance. And I tell her to come back in 3 weeks. 3 weeks is short, and I do that on purpose because after you've recommended a significant dietary change, usually after 2 or 3 weeks is when they're fed up with it and they're maybe about to drop what they had started doing with their diet, or they've been doing it for 2 or 3 weeks and they're discouraged because they're not feeling better, at which point I want to be able to troubleshoot. And also because I ask her to do some blood work and I want to talk to her about those. So she comes back 3 weeks later. And so turns out like Bernadette was very compliant with the dietary changes. So that's good. And in the last 3 weeks, instead of having near fainting episodes every day, she's had them once a week. So she had them 3 times since last time we met. And she says they were less intense. So depending on the personality of your patient, it's interesting because objectively that's actually quite a significant improvement. If your person is a relatively optimistic person and quite empowered, they will feel positive about that too. Sometimes though they come in and they're like, oh, I still feel horrible, it's really not helping, like a very negative picture. And when you ask them about the details of that, it turns out that it's actually quite good, but because they're still not feeling 100%, they have a very pessimistic outlook on their progress, in which case, and that is part of the follow-up too, you need to manage their expectations. You need to say, look, you haven't felt well for 2 years, it's only been 3 weeks and you're already improved by 50%, this is not bad, you've taken omeprazole for years, you've felt bloated for years, it's going to take time for that bacterial balance to change itself, just to kind of manage their expectation that this is quite normal. Her energy levels are better. The gassiness has reduced by about half. I always tell them to give me a percent improvement. So here she said she was less gassy, and I said, well, how much less? 10%, 20%? And she said, no, it's 50% better, but it's still there, especially later in the day. She hasn't had to take any omeprazole, and the periods were even worse than usual. So again, when we change diet, usually the body starts cleaning itself up. And remember, we spoke about emunctories in another presentation and how periods are a secondary emunctory, meaning it's not our main emunctory, but when we're detoxing, and there's a lot to detox, the body may use the period as a detox element. So it is not unusual after you've tweaked somebody's diet for the first period they have after that to be worse. That tells me I might need to support the liver a little bit more. Or sometimes I don't do anything and I say, look, I think your next period will be better because your body will have cleaned itself up. It depends on what we think of the person's toxic load. So here the fact that flatulence was better by 50% I think is great. It's because we haven't been feeding the bacteria as much. We've had less starches in the diet. To me, that's kind of normal that it hasn't resolved fully. I think she has a kind of dysbiosis that will take a very long time to clean up due to her omeprazole consumption, the food intolerances that she's been having, the fact that her symptoms were quite severe and systemic tells me that there's probably a lot of work to do in the gut. And we may suggest a stool test with her at some point. That would probably be for the next follow-up, maybe. These are her blood test results. So hemoglobin definitely low. So she has anemia. Now, does she have anemia due to folate, B12, or iron deficiency? She has minor red blood cell changes. That tells us the anemia is quite entrenched. Her iron is super low, 26. Her total iron capacity is a little bit on the high side, which tells you it's a low iron situation. Her percent iron saturation, meaning how much iron is floating around on her hemoglobin, is very low. There's not enough iron to saturate the hemoglobin. And her ferritin, which is her storage form of iron, is also low. It's still in the normal, but we would like for it to be around 40, 70 would be even better. Her B12 is on the low side as well, and her folate as well. So it's the iron that's creating the anemia. She definitely needs an iron supplement or more food sources of iron. But her folate and B12 is also low, which tells me she's not absorbing her food very well, probably due to the low stomach acid because of the omeprazole in the past, or because her gut is so irritated that absorption is just not good. So again, that tells me this is going to take a long time to turn around. So at the follow-up, this is what I tell her. Increase your red meat to 3 times a week because her iron is low. Telling her, please take an iron supplement. She couldn't stand any iron, like even an iron gluconate she couldn't stand, or a bisglycinate. So we had to do a liquid iron with her, which is a little bit more gentle on the gut, but it's horribly sweet. It's really not my favorite, and it takes a much longer time to raise iron levels with that, but we had to compromise, and so I figured a sweet iron supplement is better than no iron supplement for this person. Ideally, I would want her to go for an iron infusion, but she wouldn't go for that. And so are the frustrations of the naturopathic practice. There is an ideal textbook thing you'd like your patient to do, and then there's real life. And part of your job is to try and modify the recommendations as much as possible to suit your patient into something that they will do. So berberine and liver support to clean up the gut, probiotics because we're trying to put good bacteria there. We discussed about doing either a SIBO test or a stool test in the future. And we started some tinctures of astringent plants like Capsella, yarrow to take during the period, and cinnamon capsules to try and dry up the period a bit because she's not really taking the iron very well. Her periods are very heavy. We need to dry those up a bit. to try and improve the iron picture. So that was Bernadette. So you can see how it develops with a patient. Let's move on to another one. Go a little bit faster since you start getting the idea. This is Annie. She's 45. She tells us that her complaints are mostly digestive. She has bowel movements only 4 times a week, occasional stomach burning pains, and she feels bloated. 2 years ago, that's when it started. Just like our other clients, she takes occasional omeprazole, but no other meds. She's very stressed. She has a demanding job, 3 young kids. She wants to be a perfect mom, perfect professional. She does yoga twice a week because she can see that she needs to slow down and relax. And her energy levels are really good, but she has difficulty sleeping. Although she doesn't need any sleeping medication, she just does some meditation and it helps her fall asleep. This is what Annie is eating. Croissant in the morning, a coffee with milk, a piece of fruit. At lunch, she goes to the restaurant where she has one of those large chicken or salmon or veggie salads. Or she may go to the Chinese food court and have a Chinese soup with noodles. And sometimes she has Italian or French, and there she loves the bread basket and dessert. In the evening, she's at home. She has a steak, green veggies, potato or pasta, or chicken, vegetables, and quiche or salad. And her alcohol intake is just 1 glass of wine a day. She comes across as a person with a lot of self-discipline in general, who is concerned about her health. So for her, you see, it's not really a discipline problem. It's more about education. In her review of symptoms, she has nocturnal muscle cramps a few times a week. She tells you she has a history of depression. But that was 10 years ago. She only took antidepressants for a year, and since then she's been fine. So in our analysis, obviously stress is a huge contributing factor for her. She probably has too much adrenaline in her system. That's why she can't unwind in the evenings, and she needs the yoga to calm down. And the epigastric stomach pains are probably linked to that as well. Heartburn and solar plexus types of pain is just really your adrenal hypothalamus pituitary system that's on overdrive, which is easy to say but very hard to fix. Because she's stressed out, she tells me about the insomnia and the muscle cramps. I'm thinking magnesium deficiency. She needs a little bit more to calm down. And because she's been stressed out for a while, she's had these stomach problems and the bloatedness. Most likely her digestive system is overloaded. Like she can't digest stuff very well. When we're stressed, we have reduced stomach acid. So we feel the acidity because we have less mucus production in the stomach, but we also actually have reduced stomach acid. So again, that allows for a lot of bad bacteria to grow in there. So that irritates the gut, and so we develop a food intolerance. So I would suggest using the various databases we talked about before to analyze her diet more thoroughly, and then make some changes in her diet. So she has too much caffeine in there. She's stressed out, which means she has a lot of adrenaline going. And now she's drinking caffeine, which will further boost her adrenaline, which she does not need. And for a person whose digestive potential is reduced, having all that gluten, refined gluten, is not a good idea. So I told her to go gluten-free for a few weeks. So again, I try to make her diet as similar as possible to what she's doing now, except now it's gluten-free and reduced in caffeine. So instead of the croissant, now she has gluten-free bread. I keep in the fruit. I keep in the coffee in the morning, but I tell her to have a decaf if possible, or a white tea because she likes it, or herbal tea if she can do it. And instead of milk in there, to put coconut or almond milk, because I think of dairy as a high intolerance potential kind of food. For lunch, we eat almost all the same, the chicken, the Chinese soup with noodles, except I tell her to use rice noodles instead of the yellow noodles, and to not go for the bread basket, and generally to avoid the French or Italian restaurant for a few weeks. Her snack is now a herbal tea, and a few gluten-free cookies are still allowed. I don't change her dinner much, except I remove the quiche, because that's a lot of eggs, which is a high intolerance food, and we turn the pasta into a gluten-free pasta. So you see, we try to keep the diet as close to what they normally have. It just makes it much easier for people. Remember, their health is a priority, but the rest of their lives are going on. They're still going to work. They still only have this and that food court available around work. So try to make it easy if you can. Continue with yoga, continue with meditation. Magnesium glycinate, that's our most calming form of magnesium at bedtime to try and help with the insomnia and muscle cramps. Zinc carnosine or slippery elm tea, that's to try and help with the gastric mucosa, to help it heal from all that stress and possible little gastritis that we have there, and a probiotic, again, for that bacterial balance in the gut. Again, I tell Annie to come back 3 weeks later because that's only the second visit. She's made significant dietary changes. It's a good time to follow up. Ideally, you don't want your clients to come every 3 weeks. That's really a little bit too soon for most of our interventions. You want more like 4 to 6 weeks. But at the beginning, I like to see them soonish. So at the follow-up, she's been really good. She's reduced gluten significantly in her diet, basically hasn't had any. And her digestive symptoms have reduced by 80%. And her bowel movements are now pretty much every day, except from 4 times a week to 6 times a week. No more muscle cramps, and the insomnia still there. Falling asleep is still difficult, but it has improved by about 50%. So with this really great response, you know you're on the right track. So now I will tell her, look, it's possible that you have more intolerances, and that's why you still have 20% of bloatedness. Or you need to persevere with what you've done and the probiotics and the gut support, and it may improve further. So we do digestive enzymes. I recommend a hypoallergenic diet for 2 weeks where she avoids all sorts of other food intolerances. We boost the magnesium with one of those, either passion flower, valerian, or L-theanine at bedtime. I like to combine those with magnesium. With the more recalcitrant type of insomnia and stress picture, it usually works quite nicely. And definitely to keep gluten-free for 3 more months. I will ask her to come back in 2 weeks at the end of the hypoallergenic diet to see if it has completely resolved the flatulence or not, and continue the detective work with food intolerances. So that was Annie. And let's wrap up with one last quick clinical case, which is Anais. She's 35. She has a weight problem. She's 165 centimeter and 80 kilograms, which means she's 20 kilos heavier than 10 years ago. So basically, after she had her child, she put on a lot of weight, and it's just been creeping up since. Her periods are every 6 to 8 weeks, and pelvic ultrasound at her gynae show bilateral ovarian cyst. She's had hair loss for the last few years, and she does a lot of sports 4 times a week with a lot of intense, hot Bikram type yoga. So that's the chief complaint. Right away, I am thinking polycystic ovarian syndrome, which is a combination of weight, irregular periods, cysts on the ovaries, hair loss, or acne, and she ticks almost all of these boxes. Here is the context. Her energy levels are low because she sleeps horribly. She can't fall asleep. She only sleeps for 6 hours because she goes to bed very late due to long work hours. At the bottom here, you see her stress levels are 9 out of 10. She has a very demanding job. And she is Indian. She's vegetarian. Her breakfast is toast with jam with milk tea, and she's very proud to tell me without sugar. Her lunch, she goes to the Indian restaurant and has chapati, lentils, and veggies. Snack, she has lots of cravings. It's cookies and chocolates at work. And for dinner, she tries to be good, quote, and has eggs, salad, and a bit of pasta. In our review of systems, what comes out, she has a bit of premensal acne, a lot of type 2 diabetes in her family history. That is not surprising. Most people with PCOS will have a family history of diabetes. Remember, PCOS is almost like a kind of diabetes. She's tired with physical activity. She used to be able to do a lot more yoga than that. And she has a lot of unwanted hair growth, mustache around the breast area, beard area, for which she does laser. So it's good to ask because some women do laser. And so you can't really see that there's a hirsutism problem. But she was very open and told me about it. And so women will only tell you about this if you're open and non-judgmental. And they feel safe with you talking about these, more embarrassing symptoms. So as we analyze it, we see, right, most likely she has PCOS, which her gynae never told her about. PCOS basically means too much carbs, too much sugar in the diet. And you need to reduce that drastically for things to budge. I'm thinking, because she's vegetarian, immediately I'm concerned about her iron and B12 and protein status. The fatigue on physical activity suggests to me that we do need a blood test. So this is our analysis, which is what we talked about just now. We know from this case too, it's very difficult generally for vegetarians to reduce their carb intake. And so we know that to get this person to improve is going to be a ton of work because it is such a departure from what she's been eating currently. And you see that she's trying, but she's got a huge lack of education around all of this. And that takes time for the person to wrap their head around that and change their belief systems around food. In addition, this has been going on for 10 years. She's 20 kilo heavier than her ideal weight, which is a lot. So there will be a lot of expectation management with this client, and we know already it's going to be a long and tough journey. And I like to tell them that. So recommendations, blood test, iron, B12, vitamin D. Why vitamin D? She works a lot. She's not exposed to a lot of sunlight. She has a hormonal imbalance, probably a vitamin D deficiency there. Reduce her carbs, increase her protein. So what does that look like? Again, I tried to stick to her diet. Thankfully, she was vegetarian, but she would still eat eggs. So breakfast was eggs. And now I told her, have your tea, but please no milk in your tea. Which is very difficult. A lot of Indians like to have milk tea, which, would be fine if milk wasn't so rich in lactose, which is sugar, and therefore contributing to her weight gain. So at the Indian restaurant now, stick to your lentils and veggies. Ideally, I find lentils still 50% carb is too much for a person like that, but she needs the protein. And I try to have her eat one small Greek yogurt now to have a bit more protein and vitamin D. Her snack, we change it to a higher fat snack, so avocado or protein powder with coconut milk, like shake style. And her dinner is basically the same, except more olive oil. And we try to introduce the idea of using one of these relaxation meditation apps like Headspace, 5 to 15 minutes a day, or at bedtime to help with sleep, which we know will be difficult for her. So she does the blood work. This is what it looks like. Hemoglobin on the low side, serum iron definitely too low, total iron binding capacity high, percent iron saturation low, ferritin very low. So an iron deficiency anemia picture. Her B12, good. Her B12 is not a problem despite her being vegetarian, so that's great. And her folate is very good. So absorption is not bad. That's great. Her gut is probably not in too bad a shape. And her vitamin D is on the low side. So we tell her get in the sun, take an iron supplement because it's going to be hard to increase food sources of iron in her diet. I mean, we can tell her to have a little bit more legumes and greens, but that will not significantly increase her iron. And I can't even recommend molasses because that is just too much sugar for her PCOS. So Anais comes back 3 weeks later. Oh, and now she tells me it's very difficult to follow the diet, which I already anticipated. The bloatedness is better. In general, she feels less puffy. She feels like her body shape has changed already in 3 weeks, but her weight on the scale has not changed, which discourages her. And nothing else that she notices really. So already the follow-up now will be about managing expectation. So we troubleshoot dietary difficulties. What is it that she finds so difficult? Is it removing the milk in the tea? Does she miss the chapati and the carbs? Is it hard for her to have an avocado as a snack instead of something else? We need to talk about these things to find a compromise happy place for her. A lot about managing her expectation. And here are the supplements we recommend based on the blood work and her symptoms. She's stressed, she can't sleep, magnesium at bedtime. Her iron is low. I like the iron bisglycinate form. It's easy on the stomach, well absorbed, but only for 2 months, after which we want to see blood work again. Remember, iron can be toxic if taken for too long. And same for vitamin D, 5,000 units a day as a supplement for 2 months only, and then retest. I still recommend a little B12 just because I'd like for her levels to be a tad higher. 300 is not bad, but because she's tired and stressed, a nice methylcobalamin sublingual vitamin B12 might help her a bit. So now you've had an idea of how the first intake goes. We've gone over 3 case studies where I have purposely picked cases where the dietary impact is important. So you can see what it might look like for your case study in nutritional therapy. Remember to use those databases from the Canadian government to analyze the diet more thoroughly than what I've done here. So you actually have numbers, so you have an idea of how you need to correct the diet. After you've seen a lot of patients, you won't need to do this as much. It becomes quite obvious what needs to be done. Although some patients do like the quantitative aspect of things, in which case the databases may come in even more handy, and you may even suggest them to your clients. We also have apps that they can use that do this kind of work for them. So our summary, remember the questions asked during the intake need to be a mixture of open-ended, but also a little bit directive when the patient loses himself or herself in tangents. You need to make the client feel safe, comfortable, and tell them that this intake is a lot more detailed than a normal medical intake. Make sure you don't only ask about the chief complaint, but you then zoom out on secondary symptom and context questions, which are, remember, energy, sleep, stress, diet. And then you end with a few details about medication and review of systems. Make sure you ask very detailed questions about the diet because you'll need this information to input all of that in the database. You're not just asking, oh, you're eating white rice, you're saying how much white rice. And you want them to show you, is it a small bowl, is it 100 grams? You need to have some idea so you can put all of that in the database and figure out if they have their recommended daily allowances of their macros and vitamins, or if they're overdoing on the carbs, sugar, protein, etc. And remember that blood tests are often necessary after the first intake. If a person has iron deficiency anemia, they need that iron supplement to feel better. Nothing else will change that. They need that B12, that vitamin D, that zinc. So make sure we use our more medical tools if necessary. So this is the end of our presentation today. I hope you've enjoyed it and wishing you all a very good day.